Something is happening inside your body right now that you cannot feel, cannot see, and cannot hear. And by the time most people finally notice it, the damage has already been accumulating silently for years. Stop whatever you are doing, because what I'm about to share with you in the next 20 minutes could be the most important medical conversation you have ever had, and your doctor has almost certainly never brought it up during your 15-minute appointment. I am Dr. Stanley Brown, 20 years of internal medicine and geriatric practice, thousands of patients. And the single most terrifying pattern I have witnessed repeatedly across those 2 decades is this. Kidney failure does not arrive suddenly. It whispers. It sends signals so quiet, so ordinary, so easily dismissed, that millions of adults over 60 walk past them every single day. One of those signals happens in the most private, most ignored, most overlooked moment of your entire day, the moment you use the bathroom. Before we go any further, I want you to do one thing right now. Go to the comments and type the word kidneys in capital letters if you are over 60 and you have never once had a specific conversation with your physician about your kidney health. Just that one word, because what you are about to discover will reframe everything. Here is the reality that keeps me awake at night. The kidneys are the most silently destructive organs in the human body when they begin failing. Unlike the heart, which pounds warnings through your chest. Unlike the lungs, which announce their distress through breathlessness. The kidneys deteriorate in almost complete biological silence, continuing to function at 30%, 20%, sometimes 15% of their total capacity while their owner goes about their daily life completely unaware that an irreversible countdown has already begun. The National Kidney Foundation estimates that 37 million Americans are currently living with chronic kidney disease. 37 million. And of those 37 million, 9 out of 10 have absolutely no idea. 9 out of 10. That statistic should stop you cold, because statistically speaking, someone watching this video right now is in that group, and the warning signs their kidneys have been broadcasting have been dismissed as aging, dehydration, or simply nothing worth mentioning. Today, I am going to change that. We are covering 7 warning signs your kidneys are beginning to fail, and I am starting with the one nobody discusses. The one that happens behind closed doors every single day, the one that your body has been using to send you an urgent message that you may have been flushing away without a second thought. Sign number 1. The smell your bathroom should never have. Let me ask you something deeply personal. When was the last time you actually paid attention to what your urine smells like? Most people never do. It is one of those biological functions we perform automatically, mechanically, without observation or reflection. But that 30-second moment in your bathroom every morning may contain more diagnostic information about your internal health than a routine blood panel. Here is what healthy kidneys produce. Urine that is pale to medium yellow in color with minimal odor. A faint, slightly ammonia-like smell that dissipates almost immediately. Nothing that commands your attention. Nothing that lingers. Now, here is what compromised kidneys produce. And I need you to pay close attention because this is where most people make the critical error of dismissal. When kidney filtration capacity begins declining, the blood concentration of a compound called urea rises significantly. Urea is the primary waste product generated when your body processes dietary protein. Healthy kidneys filter urea efficiently and eliminate it through urine at controlled concentrations. But when those filtration membranes begin deteriorating, urea accumulates in the bloodstream at elevated levels, and what your body cannot adequately filter gets concentrated in whatever urine is produced. The result is a distinctly strong, persistent, sharp ammonia odor that does not dissipate quickly. Some patients describe it as chemical. Some describe it as almost sweet but wrong, a cloying, unusual sweetness that feels out of place. That sweetness carries its own clinical significance. When urine carries a sweet or fruity odor in the presence of kidney decline, it can indicate that glucose is spilling into the urine, a finding that connects compromised kidney filtration to metabolic dysregulation simultaneously. Stop right there. Think about this morning. Think about yesterday morning. Has there been an odor you noticed and dismissed? A smell you attributed to not drinking enough water or eating something unusual the night before? I am not telling you to panic. I am telling you to pay attention. A 2021 study published in the Clinical Journal of the American Society of Nephrology documented that persistent changes in urine odor, particularly elevated ammonia concentration, correlated with a measurable 34% decline in glomerular filtration rate, the clinical measurement of kidney filtering efficiency in adults over 60 compared to those with normal urine characteristics. Glomerular filtration rate. Remember that term. It is the number your physician should be checking and the number that tells the true story of your kidney health. But urine odor is only the beginning, because the kidneys do not fail quietly through one channel alone. They send distress signals through multiple biological pathways simultaneously, and most of those signals are hiding in plain sight on the surface of your body right now. Sign number 2. The foam that nobody takes seriously. Look at your toilet the next time you urinate, not a glance, an actual observation. Healthy urine produces minimal to no foam upon contact with water. The surface may show a brief disturbance that settles within seconds, leaving clean, clear water beneath. Now, if what you are seeing instead is persistent foam, bubbles that form and remain, a frothy layer that does not dissolve within 15 to 20 seconds, your kidneys may be communicating something critically important. The medical term is proteinuria, and it means protein is leaking through your kidney filters into your urine when it should not be there at all. Here is the mechanism. Your kidney filtration units, microscopic structures called glomeruli, are designed to retain large molecules like protein within the bloodstream while eliminating waste products and excess fluid. When these filtration membranes sustain damage from elevated blood pressure, chronic inflammation, or diabetic vascular injury, they develop microscopic perforations. Protein molecules that should remain in circulation begin escaping through those perforations into the urine. When protein-containing urine hits toilet water, it foams, exactly the way dish soap foams when it contacts water. Think about that image for a moment. Protein leaking from damaged filters, escaping through microscopic tears, appearing as foam in your toilet every single morning while you stand there and assume it means nothing. A landmark study from the American Journal of Kidney Diseases established that persistent foamy urine indicating proteinuria is present in approximately 1 in 5 adults over 65. And that in the majority of those individuals it represents the earliest detectable external indicator of progressive glomerular damage that if left unaddressed advances toward end-stage renal failure within 5 to 8 years. 5 to 8 years. From foam in your toilet to dialysis. The bridge between those two realities is awareness, early detection, and intervention. And right now you have the awareness. What you do with it determines everything else. Sign number 3. The swelling. Your doctor blamed on something else. I want you to look at your ankles right now. Press your thumb firmly into the skin just above your ankle bone and hold it for 5 full seconds. Then release and observe. Does the indentation remain visible for several seconds before slowly filling back in? That is called pitting edema. And while occasional mild ankle swelling can result from prolonged standing or heat exposure, persistent pitting edema that greets you consistently in the evenings, that is present when you wake in the morning, that leaves sock impressions embedded in your skin, that swelling is telling a completely different story. Your kidneys regulate the precise fluid and sodium balance throughout your entire body. When filtration capacity declines, sodium and fluid accumulate in tissue rather than being eliminated through urine. Gravity deposits that accumulated fluid in the lowest anatomical points, your ankles, your feet, occasionally your lower legs. But here is what makes this sign particularly dangerous and particularly dismissed. Swollen ankles in older adults are reflexively attributed to heart conditions, varicose veins, medications, or simply age. And while all of those can contribute, the kidney origin is frequently overlooked entirely. Patients receive treatments targeting the wrong system while their actual kidney filtration continues declining unaddressed. I had a patient, a 72-year-old retired accountant from Florida, who had been managing what 3 separate physicians diagnosed as cardiac-related ankle edema for nearly 4 years. 4 years of diuretic medications, 4 years of compression stockings, 4 years of being told his swelling was a heart problem. When he finally arrived at my practice, a comprehensive metabolic panel revealed his glomerular filtration rate had dropped to 28% of normal function. He was in stage 4 chronic kidney disease, and nobody had checked his kidneys because everyone assumed the heart was responsible. 4 years. The intervention that could have slowed his progression significantly, had it begun when the swelling first appeared, was no longer available at stage 4. Do not let that be your story. Sign number 4, the one most people ignore until it is too late. This is the sign I referenced in the title, and I need you to understand why it carries that distinction. Fatigue. Before you dismiss this, stay with me, because I am not talking about the ordinary tiredness that follows a poor night of sleep or an active day. I am describing something categorically different. A bone-deep, relentless, chemically induced exhaustion that no amount of rest resolves. When kidney function declines, the organ loses its capacity to produce adequate quantities of a hormone called erythropoietin, EPO. This hormone is the biological signal that instructs your bone marrow to manufacture red blood cells. Red blood cells are the oxygen transport vehicles of your circulatory system. Without sufficient red blood cell production oxygen delivery to every tissue in your body, your brain, your muscles, your heart, becomes progressively compromised. The resulting condition is called renal anemia, and it produces a quality of fatigue that is fundamentally different from normal tiredness. It is the fatigue of oxygen starvation at the cellular level. Patients describe climbing a single flight of stairs and needing to sit down afterward. Describe starting a simple household task and finding themselves unable to complete it. Describe waking after 8 hours of sleep feeling as though they have not slept at all. Describe a mental heaviness, a cognitive fog that makes previously effortless thinking feel laborious and slow. And here is the devastating reality. Because fatigue is so universally attributed to aging, to stress, to poor sleep, to medication side effects, renal anemia sits undetected for an average of 2 to 3 years before it is identified as kidney-related in adults over 60. 2 to 3 years during which kidney function continues its silent decline while the patient is told they simply need better sleep habits or a reduction in stress. A 2020 study from the National Institute of Diabetes and Digestive and Kidney Diseases found that unexplained persistent fatigue in adults over 65 was associated with a 47% higher probability of previously undiagnosed chronic kidney disease compared to age-matched controls without fatigue complaints. 47% higher probability. If you are exhausted in a way that rest does not fix, your kidneys deserve to be on the list of suspects. Sign number 5. What your skin is screaming at you. Your skin is the largest organ in your body, and it is also one of the most articulate communicators of internal dysfunction, if you know how to read what it is saying. When kidney filtration fails to adequately remove waste compounds from the bloodstream, those compounds do not simply accumulate passively. They seek alternative elimination routes. One of those routes is the skin. Uremic toxins, waste products that healthy kidneys would have filtered and eliminated, begin depositing in skin tissue as blood concentrations rise. The result manifests in two highly visible ways that most people attribute to unrelated causes. The first is persistent itching, not the localized itch of a mosquito bite or a skin irritation. A widespread, deep, maddening itch that intensifies at night, that affects the back, the legs, the arms, that no topical cream adequately addresses because the source is internal rather than dermatological. This is called uremic pruritus, and it affects approximately 40% of patients with advanced kidney disease, the majority of whom spend years applying moisturizers and antihistamines to a problem that originates in their bloodstream. The second is a characteristic change in skin tone, a dull, grayish, or yellowish cast to the complexion that develops gradually and is frequently attributed to fatigue, poor nutrition, or simply aging skin. This discoloration results from the accumulation of urochrome, a pigment normally eliminated through urine, depositing in skin tissue when urinary elimination is compromised. Look at your skin in natural daylight today. Look at the skin on your forearms and the backs of your hands. Compare it to photographs from 5 years ago. Has the tone shifted? Has a grayness or yellowness appeared that was not there before? Your skin may be showing you what your blood tests have not yet confirmed. Sign number 6. The sleep disruption with a hidden origin. How many times do you wake up during the night to use the bathroom? Once is within normal range for adults over 60. Twice begins to warrant attention. 3 or more times, nocturia as it is clinically designated, is your kidneys communicating a specific and important message about their functional status. Healthy kidneys possess the biological capacity to concentrate urine during sleep, producing less volume at higher concentration, so that the body can rest through the night without interruption. This concentration capacity depends on specific cellular mechanisms within the kidney tubules that are among the earliest functional casualties of progressive kidney disease. As those mechanisms deteriorate, the kidneys lose their ability to concentrate urine during overnight hours. The result is high-volume, low-concentration urine production continuing through the night at the same rate as waking hours, compelling repeated bathroom visits that fragment sleep, elevate overnight blood pressure, and leave the individual in a state of chronic partial sleep deprivation that compounds the renal anemia fatigue described in Sign 4. The dangerous dimension of this sign is how completely normalized it has become in older adult populations. Virtually every senior who mentions nighttime bathroom frequency to their physician receives one of two responses: a bladder capacity explanation or a prostate explanation for male patients. The kidney explanation is offered with remarkable infrequency despite representing one of the most clinically reliable early indicators of declining renal tubular function. A 2022 study from the Journal of the American Geriatric Society found that adults over 65 experiencing 3 or more nightly bathroom visits had a 52% higher incidence of previously undetected chronic kidney disease compared to those without nocturia, independent of prostate size, bladder capacity, or fluid intake patterns. 52% higher incidence. The next time you rise at 2 in the morning and again at 4, consider the possibility that your kidneys are responsible. Not your bladder, not your prostate, your kidneys. Sign number 7. The breath that reveals what your blood cannot hide. This final sign is the one that arrives latest in the progression of kidney decline, and its presence indicates that the situation has moved beyond early intervention territory into urgent medical attention territory. When kidney filtration capacity drops below approximately 20% of normal function urea, and other nitrogenous waste compounds accumulate in the bloodstream at concentrations that begin affecting multiple organ systems simultaneously. One of the most distinctive manifestations occurs in the respiratory system. As blood urea nitrogen levels rise, the compound begins volatilizing through expired air during breathing. The result is a characteristic breath odor that patients and their family members describe consistently as fishy, ammonia-like, or resembling the smell of urine itself. This is called uremic fetor, and its presence is a clinical emergency signal. If you or someone close to you has noticed this quality of breath, a persistent ammonia or fish-like odor that is not explained by diet or dental hygiene, this is not a conversation to defer to your next scheduled appointment. This is a same-week conversation with your physician. Uremic fetor indicates that waste compounds are escaping through your lungs because your kidneys can no longer manage the filtration burden. It is your body's absolute last resort communication channel, the biological equivalent of a final distress flare fired when every other signal has been ignored. What you must do, starting today. 7 signs. 7 biological distress signals, any one of which could be present in your body right now while you attribute it to something entirely unrelated. Here's the action plan I give every patient who sits across from me with these concerns. First, request a comprehensive metabolic panel from your physician at your earliest opportunity. This single blood test measures your glomerular filtration rate, the definitive indicator of kidney function, along with creatinine and blood urea nitrogen levels. It costs almost nothing. It takes minutes, and it provides a complete picture of your kidney status that no amount of symptom observation can match. Second, request a urinalysis simultaneously. This simple urine test detects protein leakage, identifies abnormal compounds, and confirms or rules out the filtration compromise that foam and odor changes suggest. Third, know your numbers. A glomerular filtration rate above 90 is normal. Between 60 and 89 indicates mild decline requiring monitoring. Between 30 and 59 represents moderate decline requiring active management. Below 30 is advanced decline requiring specialist involvement immediately. Fourth, address the modifiable risk factors that accelerate kidney deterioration. Uncontrolled blood pressure is the single most destructive force acting on kidney tissue over time. Uncontrolled blood sugar in diabetic patients is the second. Both are manageable. Both require consistent attention. Both directly determine the trajectory of your kidney health across the coming years. Fifth, hydration. Your kidneys require adequate fluid to perform their filtration function. Most adults over 60 are in a state of chronic mild dehydration that concentrates waste compounds in the bloodstream and increases the mechanical workload on already stressed filtration membranes. 8 to 10 glasses of plain water daily, distributed consistently rather than consumed in large volumes at infrequent intervals, represents the most accessible and most underutilized kidney protective intervention available. Here is what I want you to truly understand as we close today. Kidney disease is called the silent killer for a precise and literal reason. It does not announce itself dramatically. It does not create the kind of acute crisis that compels immediate medical attention. It operates in the background, quietly, methodically, invisibly, until the damage has accumulated beyond the point where meaningful reversal is possible. But silence does not mean absence of signals. Every sign covered today was present in my patients before their diagnosis. Every single one. The foam in the toilet, the ammonia smell in the bathroom, the swollen ankles attributed to heart disease, the exhaustion attributed to aging, the itching attributed to dry skin, the nighttime bathroom visits attributed to the bladder, the breath that the family noticed but nobody mentioned to the doctor. The signals were there. They were simply not recognized for what they were. You now have that recognition. And recognition, acted upon promptly, is the difference between a manageable chronic condition and an irreversible terminal one. Do not wait for the dramatic announcement that kidney disease rarely makes. Act on the quiet signals it has already been sending. Book that blood test this week, not next month, not after your next scheduled appointment, this week, because the kidneys you protect today are the kidneys that will carry you through the decades ahead. Now, I have one final question for you, and I want your honest answer in the comments below. Which of these 7 signs have you experienced and dismissed as something else? Your answer could be the specific insight that motivates another viewer to finally make that appointment. I read every single comment personally because every person watching this matters to me. Not as a viewer, but as a patient. If today delivered something genuinely valuable, please give this video a like. Subscribe so you never miss the health information designed specifically for your life after 60. And share this immediately with someone you love who has never once had a real conversation about their kidney health, because you might be giving them something far more valuable than they realize. I am Dr. Stanley Brown. Your kidneys have been working for you every moment of every day since before you drew your first breath. They have never asked for recognition. They have never demanded attention. They have simply filtered and balanced and protected, quietly and without interruption. Give them the attention they have earned. Your health, your independence, your future. It is worth one blood test. Start today.